Hello, I'm Carl Cannon, Washington Bureau Chief for RealClearPolitics and Executive Editor of the RealClear Media Group. Thank you for joining RealClearPolitics and Mothers Against Prescription Drug Abuse for this online event, The Family Frontline, Overlooked in the Opioid Crisis. Amid an ongoing crisis that has ravaged America for more than 2 decades, new challenges have emerged. One is bolstering family caregivers and crafting strategies designed to safeguard them from harm. As the U.S. population ages, the responsibility for primary medical care is increasingly falling on the shoulders of family members. Drug prescriptions intended for limited use or aging family members are now more easily accessible in the home to both adults and young people, some of whom have battled previous addiction issues of their own. We will talk with former member of Congress, Patrick J. Kennedy, and hear from a panel of experts in the field of addiction. But we begin with Mary Bono. She served in Congress for 7 terms as a representative from California. She was known in Congress as a consensus-building moderate who decided issues based on their merits instead of ideology or the orders of party bosses. She co-founded the Prescription Drug Abuse Caucus in Congress and chaired hearings into opioid abuse. And though she left Congress in 2013, she remained active. Today, she is the chairwoman of the board of Mothers Against Prescription Drug Abuse, MAPDA, and is the host of Sagely Speaking with Mary Bono, a thought-provoking podcast. Welcome, Mary, and thanks for joining us today.
Thank you so much. I want to thank you and RealClearPolitics for partnering with us on this very important conversation. I want to thank those who are listening or watching on our discussion, The Family Frontline Overlooked in the Opioid Crisis. This is an important and timely conversation to hold as we continue to fight an ongoing battle that touches almost all Americans in one way or another. That battle is our reliance, overprescribing, and addiction to prescription and illicit opioids. As Carl just said, my name is Mary Bono, and I am a former member of Congress, but I'm also a tireless advocate on overdose and drug abuse prevention, and most importantly, I am a mother. And addiction has directly impacted my family, and I've spent my entire career fighting on behalf of those who often cannot fight for themselves. During my 15 years in the U.S. Congress, and as the co-founder and CEO of Mothers Against Prescription Drug Abuse, which was an organization founded by 3 mothers who each lost a child to an accidental opioid overdose, I've used my personal experiences in the service of others with the goal of ending opioid and other drug addiction in America. Despite continued efforts in the U.S., including congressional and presidential attention from both parties, we continue to lose 212 Americans daily to opioid abuse, according to the most recent numbers from the National Center for Drug Abuse Statistics. And so many of these deaths and overdoses are entirely preventable, and something must be done. Today's conversation will center around the importance of families and caregivers as a vital frontline to helping stop the opioid crisis in the home. In 2021, 50,000 American seniors experienced an opioid overdose, and the number of seniors who died from an opioid overdose increased by 63% between 2012 and 2020, according to the Department of Health and Human Services and the CDC. Family members, friends, and licensed caregivers are often the first to recognize a dangerous and life-threatening situation in the home, and they can be the first to step in to intervene. It's up to us to help better equip these individuals with the education and the tools to save a life. I encourage my colleagues in Congress to adopt common sense solutions that would have an immediate impact on strengthening our caregiving front line. There are 2 practical first steps that would make significant inroads into solving the opioid crisis in the U.S. The first would be the reauthorization of the Support Act, which would strengthen important programs that bolster prevention, treatment, and recovery services for Americans with substance use disorders and mental illness. The second is the passage of the Alternatives to Pain Act. This legislation would increase access to non-opioid forms of pain management while making these novel drugs more affordable for seniors and other disadvantaged populations. This legislation would allow a patient and a doctor to have a choice on how pain is managed and would help keep opioids out of the home, where they might be abused by either a patient or diverted into the hands of others, including children. According to the CDC, 90% of patients receive opioids to manage pain, and this legislation would allow patients to decide what option is best for their unique situation. Opioids still have a time and a place in pain management, but it is time we embrace innovation to give families and patients the power of choice. So I'm delighted to share today's important discussion with experts in this field. And it's important to know there is no panacea to this crisis, but every option in the service of ending addiction in America must be embraced.
Let's start the beginning for you and me about this issue we're talking about today, because it's a personal one to you and to me. You had a child who became addicted to prescription drugs, and I lost my nephew, who was also my godson, to heroin in 2011. So tell us how going through this personally impacted your family.
Thank you, Carl, and I'm sorry about your loss, and I'm glad that you're here to have this conversation since you know so well what the problem is. My son had become addicted to OxyContin when he was in high school. He's now 35, but he got his master's degree in psychology. So it was a long road and a very scary time way back in 2007, 2008. But none of us really knew at that time that OxyContin was this drug of choice for kids. Look, it was widespread throughout Appalachia and Florida, but also in Southern California. But parents didn't know about the problem until it really directly impacted them and they woke up. I interviewed a guest the other day on my podcast who said he had never even heard of OxyContin until he found his son dead on the floor from it. So these overdoses are preventable. And I believe that we've sort of lost the narrative here on telling kids that drugs are they're not healthy, and they're so much more dangerous now. The drug supply is so much more dangerous now than it was, say, when you and I were kids, Carl. There's no room for error. The DEA says one pill can kill, and that's 100% true.
Can you talk to us a little bit about your decision to start Mothers Against Prescription Drug Abuse and what that process was like?
Well, I was in Congress at the time, and my son and I had spoken publicly about his, introduction and then addiction to OxyContin, which I think was very brave of him. But that made us sort of be beacons for other parents who were going through it too. So a reporter introduced me to a mother who had just lost her son to a prescription pill. And then I met another mother within a week or so who had lost her son as well. So it was founded by three mothers who all lost a child to an accidental overdose that was preventable. I was in Congress at the time, so I didn't join the board, but I was very close with them and stayed involved. But in 2018, one of the mothers, her name is Janet James, said, I've had enough. I want to move on from my son's death, and asked me to take over Mothers Against Prescription Drug Abuse, or MAPDA. So I did, and we've got a fabulous board of committed women and a small team. But, again, it fuels me. My son asked me the other day, Mom, why do you keep doing this? And I said, it's easy. I want future generations to be spared a lot of the pain that my generation is feeling that is avoidable. And that, to me, is this opioid epidemic.
Well, and I become aware, and you talk about a lot on your podcast, how families have become really the first line of defense. Maybe they always were. But, we had, Medicaid is under strain. We had COVID, put a stress on the entire healthcare system, not just in this country, but around the world. But families are now, you could say the first line of defense and sometimes the last line of defense in terms of caregivers. In your podcast, you interview people whose lives have been upended by this scourge, and talk about what families go through when faced with addiction, opioids, and the misuse of it. Is it fair to call this crisis or this topic, the burden borne by families, the neglected tragedy of this crisis?
Oh, absolutely. And there was a great article not too long ago talking about the collateral damage of addiction. And you've been impacted, as have I, and it is a family disease. And I sometimes call people who love somebody who's struggling with an active addiction, I think I call it walking wounded, because it's very scary. It's very terrifying. And so, it affects the entire family. And I think that's why it's really important that families get in and get professional help to understand how to manage their role in it. But the conversation on caregiving too, and understanding that there are alternatives to opioids, hopefully coming down the pike, is very encouraging. Originally the OxyContin and other prescription pill epidemic was being fueled by pills that were being diverted out of the medicine chest. And they were being diverted to kids. There were stories way back when of even open houses that realtors were seeing people go into bathrooms and going through the medicine chest to see if they could find some opioids. So it's one of the reasons that trying to to fill the medicine chest with non-addictive options, but oh, by the way, that are effective. Like, I believe there is a time and a place for opioids. As I've said, I've had to use them when I've had serious acute pain, broken arm, surgery, things like that. So there is a time and a place. However, we need to do better with innovation. We need to bring products out that are non-addicting. People say that it's either, some people say 3 days, some people say 5. But a course of opioids, if you take it for 3 to 5 days, is all it takes to become habituated or addicted to them. And that's why it's critical we get alternatives. And, for the caregivers, have a peace of mind that that one less thing to worry about is the diversion of what's in the medicine chest.
Can you talk to us a little bit about your decision to start Mothers Against Prescription Drug Abuse and what that process was like?
Well, I was in Congress at the time, and my son and I had spoken publicly about his, introduction and then addiction to OxyContin, which I think was very brave of him. But that made us sort of be beacons for other parents who are going through it too. So a reporter introduced me to a mother who had just lost her son to a prescription pill. And then I met another mother within a week or so who had lost her son as well. So it was founded by 3 mothers who all lost a child to an accidental overdose that was preventable. I was in Congress at the time, so I didn't join the board, but I was very close with them and stayed involved. But in 2018, one of the mothers, her name is Janet James, said, I've had enough. I want to move on from my son's death, and asked me to take over Mothers Against Prescription Drug Abuse, or MAPDA. So I did, and we've got a fabulous board of committed women and a small team. But, again, it fuels me. My son asked me the other day, Mom, why do you keep doing this? And I said, it's easy. I want future generations to be spared a lot of the pain that my generation is feeling that is avoidable. And that, to me, is this opioid epidemic.
Let's end on this then. We end on an upbeat note because it's not an upbeat topic, but it seems that it's a bipartisan issue. It doesn't seem like this issue has yet, fingers crossed, been just reduced to partisan talking points, and where people use it to attack the other side. And I assume that's because, well, I hope I'm right about that. You let me know what you think. But so it's a 2-part question. But if I am right, is that because this is a crisis that affects people of all socioeconomic strata, all races, all ages, and all political viewpoints?
It is definitely bipartisan. And the important point is every single member of Congress's district is affected, and acutely so. So I think it brings them to the table. What frustrates me a little bit is the lack of urgency at some point. Like right now, we need to get the Support Act reauthorized. It is called the Support Act, get Support 2.0 across the finish line and onto the president's desk. And the same with the Alternatives to Pain Act. And this is a busy year for sure for legislation. But these things, I think, should take high priority because they're not partisan. There's not a single bill that I know of that is a hyper-partisan issue. There's a bill Debbie Wasserman Schultz and Buddy Carter are on together, which addresses the social media aspect of how kids are getting their drugs now. So you see partnerships like this. They exist. The media just doesn't like to talk about them because they're not as, they don't trigger our dopamine on the political arguments we have at home.
Well, we're doing our part in Real Clear Politics, Mary, and I promise you we'll continue to do what we can. Thank you for doing this with me.
Well, Carl, it's a privilege. I'm a fan of Real Clear Politics. I go to the website. I send it out to people all the time. So it's an honor that we could be here together today. So thank you.
Talking now with Patrick J. Kennedy. Patrick Kennedy served in Congress as a representative from Rhode Island from 1995 through 2011. He's the son of legendary Senator Edward Kennedy and the nephew of John F. Kennedy, who before his presidency, while he was still in the Senate, inspired Americans with Profiles in Courage, a book that told the stories of 8 U.S. senators who bucked the party line and changed this country for the better. along with healthcare journalist Stephen Fried, Patrick Kennedy has co-authored a new book, Profiles in Mental Health Courage, describing the journeys of a diverse group of Americans who describe their mental illness, treatments, and struggles for the first time. This book is a follow-up to Patrick's best-selling memoir, A Common Struggle. While he was in Congress, Patrick was a member of the Opioid and Drug Abuse Commission, and he's also co-founder of One Mind, a mental health nonprofit. Welcome, Patrick Kennedy. Thank you for being with us.
My pleasure. Thank you, Carl, for having me.
All right, let's start. I love authors, so we've got other ground to cover. Can we start with your book? I'd like to ask you a question.
Sure, please. Okay. Thank you.
So what did you learn from writing and researching profiles in mental health courage that you did not know before?
Well, the thing that I was so amazed by and reason for the title, Profiles in Mental Health Courage, is it is remarkable how right now in our history, people are willing to be so transparent about their own struggles. It was also something that they were willing to have their family members share their experiences living with them and their disease. And of course, in many of these narratives, we just hear a first-person account. We don't hear about the parents, the sisters, the brothers, the loved ones, the children, the coworkers, the physician, therapist. So really, if we are to have America understand these illnesses and their complexity, it helps a lot to have the perspective of those who are living around the person with the diagnosis. And I'm really proud of the fact that everyone that I interviewed really signed on to being totally transparent, including having me speak to people that they don't even speak to anymore. And of course, that's quite frankly very ordinary if you have these illnesses, because these illnesses are marked by kind of antisocial behavior that really pushes people away, makes them not want to be around you. And we have to understand this. Part of the reason we're in such bad shape in terms of a policy and political response is that there's not a lot of enthusiasm to stand up for people with these illnesses. And that's the nature of these illnesses. So it's ironic that we distance people and we make their illnesses worse by disconnecting. We know from the Surgeon General's report, and the more detached people are from community, the worse their illnesses get. And yet, what's the nature of these illnesses? To detach. So at the end of the day, we need to understand all of these kind of atmospherics if we're to get to good policy. And good policy means we don't wait till these illnesses become stage 4. As my friend Paul Gianfrido, former head of Mental Health America, said, we need to screen for these illnesses at stage 1, just like we do with cancer, diabetes, heart disease, and everything else. And of course, they ask you, do you have a family history of addiction, of mental illness? And frankly, we don't really have that question, but for the last couple of years, usually we have, do you have a family history of cancer and cardiovascular disease? We're fine answering those questions. But back to the parity law I was so honored to sponsor, we need to have that same approach for brain illnesses that we have for the rest of the body. And in opioid treatment, recovery, and in research, we need to have a warp speed like we had with the COVID vaccine. Like we got that done in no time, relative to new drugs, because we had the will to produce it. We need that same will to produce a non-addictive analgesic, i.e. pain reliever. And that's why I'm so happy that my good friend, former Congressman Mary Bono, has been so outspoken and leading this charge. I loved working with her because these are bipartisan issues, obviously, and they're frankly issues that could bring this very polarized world politically together, because it doesn't matter who you are, what your background is, these issues affect everybody.
Let me ask you a question about that, because this Alternative to Pain Act is introduced earlier this year in the Senate by Senator Tom Tillis, conservative Republican, and Mark Kelly, Democrat from Arizona. And I was struck by the bipartisan nature of it. And I was wondering if that consensus is still holding. You still have friends on Capitol Hill. Are people still able, to work on these kinds of issues that really are not ideological or shouldn't be?
So just as an example, when I moved to my new neighborhood after I got married, and very red area, so to speak, politically, the woman who ran the church choir was, let's just say, 100% polar opposite from my political philosophy. But one day she approached me because she knew of my original book, which thankfully my church allowed me to speak about. And she said, I need your help. My son has a need to get right into treatment. If he doesn't get in right away, I'm really worried he's going to die. And so one of the benefits I have is I've got a Rolodex. I called right up. I got him in that day. I knew the hospital administrator, and I knew the best treatment place that was within manageable distance. I got him scholarshiped. And listen to this. 4 years later, I am standing at the altar baptizing my youngest child, and he's there baptizing his baby. And his two parents, who, as I said, are polar opposites politically, are there weeping at the miracle of both their son's recovery and the fact that they have this miracle of a baby with him as a sober father. And they wrapped their arms around me. They said, anything we can ever do for you, Patrick, you've got us. Now, the only reason I share that story, because it's a real story, is that these issues know no political bounds. Obviously, a big part of the recovery process is a spiritual connectedness. And I think all human beings want that desire to be connected to something bigger than themselves. Of course, for those of us in recovery, it's an absolute necessity so that we don't feel like we're running the world and we're all isolated. We need each other. And I think that's a universal human desire, and it cuts across any kind of political barrier. I know I could go anywhere in this country. Frankly, when I go to 12-step meetings. And I say 12-step because I'm not betraying the 11th tradition of my program. I want my fellows to know it's possible to be public about recovery, just so long as you don't identify your membership and what kind of program you're in. And when I go on Fox News, as I'm often asked to do, my phone lights up from all my fellows in recovery who I never knew, right? Watch Fox News. And it doesn't matter, but it's just interesting that when you're a fellow in recovery, that's the most important thing. And everything else falls by the wayside. So I love what you guys are doing and Mary's doing and this advocacy for the No Pain Act.
Thank you. In your book, there's another group that you talk about that doesn't really get enough attention. I mean, that's the purpose of this event. You and Stephen Fried also interviewed caregivers, not just family members, caregivers. What did you come out of that thinking? What's the public policy that we need to bolster the caregivers of addicts and people with mental health? What should Washington be doing?
Well, first of all, we need to know that everybody with a complex disease, the medical approach can only cover so much. And if we, just as a practical matter, want to save ourselves all of the red ink, the costs that it would take to pay for all the medical wraparound, I mean, we would be bankrupt. And so what we need to do is understand that these caregivers can't be taken for granted. We need to be putting policies in place that support those caregivers, because you could either pay to support, frankly, a loved one who is doing all the work of a caregiver is still less expensive than sending someone to a nursing home, someone to a rehab. And so we'd be much better off just financially. I'm not talking yet about the emotional well-being of those caregivers, but financially, if we did more to support them. But the other part of your question, I think, is obvious. Those caregivers get burned out. And if we don't want them to get so burned out that they shift their loved one to the government for the entire payment, then it makes sense financially, it makes sense for them as caregivers to get the support, because with that support, they're going to be better off mentally so that they can help their loved ones be better off mentally. And unfortunately, if you have this disease of addiction, it is a family illness. That's the point I make in this book. And unfortunately, it's not only genetically a family illness, because there's higher propensity for addiction amongst those who share, a family history, but environmentally, people get into a risky situation if someone is active in their addiction because they're around it. And there's, especially with the No Pain Act, seniors have need for pain management. There's a bunch of, opioids laying around the house, not for nothing. Everybody has a need. Periodically, they feel like to escape. They see that behavior of taking a pill as modeling as a way to get out from underneath feeling like we all feel as human beings. And that is the reason why we need to come up with non-addictive pain medication. And it can't be more difficult to get a non-opioid as an opioid, because think of all the costs that are incurred even with the tightening up of the screws on the prescribing, it's still the primary way people get into this terrible disease of opioid addiction is the exposure to pain medication. Why don't we treat that and we'd save all the downstream costs? But what do we think about? We only think about the fact that it costs pennies to provide an opioid, and it costs dollars to provide a non-opioid. But that's only looking at it in a very short-sighted way. What are the true costs behind paying for an opioid, when if you pay for a non-opioid, we'd save all those costs down the line? In other words, we're not looking at the full costs. And all I would say is we need to do a better job showing pharma, the very people that are going to be coming up with these, just like we did with the COVID vaccine, that there is a market, there's a path to reimbursement. Federal Trade Commission really stepped on those pharmacy benefit managers recently, saying that they don't always have the consumer's interest at heart. They're trying to save a buck, pass the buck when they do that. And who pays? The person who gets addicted, who may not have otherwise if they had had a non-opioid, and the family is impacted, as this important discussion is pointing out.
Patrick, when you look at the depressing statistics from overdoses from heroin and fentanyl, and also at the burgeoning homeless crisis, it seems to me that the connection between mental health and drug addiction has stymied policymakers, that they don't see the link. Is there a more holistic way government could approach these? You've dealt with both issues in your life. So is there something or are we not looking at it with a broad enough lens?
Well, I believe in the work that I've done at the Kennedy Forum, that we need a holistic approach. John F. Kennedy had the Community Mental Health Act. We need a community approach, because if you're in recovery, you need housing supports. In fact, we don't pay for recovery housing. That's a lot less expensive than sending people in and out of these kind of rehabs and paying for all the emergency rooms when they overdose, and all the police and fire who have to respond when they overdose. So the bottom line is we got to pay for things in a different way. So you mentioned mental health. We share 99% of the same interests as people with schizophrenia, bipolar, eating disorders, alcoholism. We're all dealing with the need for a threefold illness, a physical part of it, a social part of it, a spiritual part of it. We need that wraparound, or else it's like a three-legged stool. You're pulling out one, it falls over. So frankly, I'm a Democrat, so it's not hard for people to see that I use the AFL-CIO. So our unions. You have Teamster truck drivers working with municipal employees, working with sheet metal workers, working with carpenters. They have the AFL-CIO. We need an AFL-CIO of addiction and mental illness. We are so siloed by the diagnosis, and our advocacy is so siloed. And frankly, the trade groups that crop up around each of these treatment modalities are so siloed that we lose sight of the fact that we share so much in common. So the Kennedy Forum has put together the first ever kind of comprehensive policy guide. Because when I was in Congress, you couldn't come up and know what everyone wanted. You had, eating disorders in the morning, depression in the afternoon, schizophrenia at lunchtime. We need to have what other really sophisticated advocacy groups have, and that is a comprehensive agenda. And we need to support each other, because if you add all of our consumers and those who work in this field together, we are the biggest special interest group in this country, bar none. And our constituents are motivated. So if I went to a member of Congress or a state rep, a governor, and I said, this is how many people you have in your voting state, your congressional district that care about this issue, their eyes would pop open. They'd say, not only is this a good political issue, I won't be able to get elected unless I do their list of priorities. So ultimately, we need to produce that list. My wife ran for Congress. I could get 1,000 teachers by the end of the week to do an event for my wife. I couldn't get 1,000 people who both care for those survived suicide, survived overdose, have schizophrenia, have bipolar. You just can't. You can't get the psychologists and psychiatrists and the social all on the same list. We have to have the benefit of what others have had in advocacy, and that is a unified vision and approach to accountability when it comes to policymakers.
Patrick J. Kennedy, thank you so much. We don't have holistic approaches in Washington anymore. We rarely have bipartisanship. We miss that kind of voice. If you ever come back to Washington, please let us know. Congress could use you.
But thank you, Carl. Appreciate being on.
Thank you. Now we begin the final segment of our program, the Family Frontline, Overlooking the Opioid Crisis. I'm Carl Cannon, Washington Bureau Chief of RealClearPolitics. We are co-hosting this event with Mothers Against Prescription Drug Abuse. Now let me introduce our panelists. Ebony Copeland is director of the Howard University Student Health Center and a professor in the Department of Community and Family Medicine in the College of Medicine. Dr. Copeland earned her bachelor's degree from Hampton University, a master's of public health at Virginia Commonwealth University, and attended medical school at the University of Kansas. She completed her residency in family medicine in Chicago. Previously, she worked as a director of adolescent medicine at Morris Heights Health Center in the Bronx. Next, we have Marvell Adams Jr., a passionate advocate and educator with a lifelong commitment of service to caregivers, marginalized communities, and older adults, which we're going to focus on today. He is the CEO of Caregiver Action Network. Marvell earned a master's degree of healthcare administration with a specialty in aging services from the University of North Carolina in Chapel Hill. He has served on the boards of well-known and respected aging service entities and won numerous awards for his tireless advocacy in the field of public health. And last but not least, Kathleen Cameron is Senior Director of the Center for Healthy Aging at the National Council on Aging. She has more than 25 years of experience in the healthcare field as a pharmacist, researcher, and program director focusing on falls prevention, geriatrics, caregiving, mental health, and long-term services and support. At the National Council of Aging, Kathleen provides subject matter experience on healthcare programmatic and policy-related issues and oversees the Modernizing Senior Resource Center. Dr. Copeland, let me start with you and ask you about prescription drug abuse on college campuses among vulnerable populations. Has word gotten out among young Americans about the dangers of these drugs? What are you seeing today with college students?
Yes, I definitely think that the word has gotten out with regards to the dangers of these drugs. It's hard to avoid. I mean, with media, news, social media, always talking about the opioid epidemic. I think that they're very much aware of the issues that are going on. I think, though, that the problem is, do they feel like it impacts them or do they feel like it concerns them? You know, young people tend to know about dangers and feel like somehow that they're immune. So they're definitely aware of the issues that exist, but does it impact them directly? Do they feel like it impacts them directly? Although it very well does and can, especially since medications or opioids are found in Adderall, any other pills, prescription medications that are out there. However, oftentimes they don't see it as impacting them directly.
Kathleen Cameron, from your perch at the National Council on Aging, can you describe some of the special challenges seniors face with pain and safe opioid options? And I've got a couple follow-ups to that.
Yeah, absolutely. And first, I'd just like to touch on, some what the data tells us about older adults. We know that fatal overdoses among people age 65 and over has actually quadrupled. Since 2022, with highest rates among African American populations. So that's a really significant current concern for us at the National Council on Aging. And we do a tremendous amount of work in the mental health arena. And typically, what we often see among the older adult population is we have folks who maybe have been, substance users throughout their life and they're aging, or they begin later in life. But there's often a strong intersection with mental health problems among the senior population, whether it's serious mental illness such as schizophrenia or bipolar disorder, or depression, anxiety that has not been treated. We know about 20% of older adults have some type of mental health or substance use disorder, but only about 40% of those get any treatment. So that's a real concern for us.
If you're an elderly person who's fighting addiction problems or a mental health problem or both, and you slip through the safety net, Medicaid or Medicare is not there for you. So frequently, your caregiver would also be another elderly person, wouldn't it?
Absolutely. Absolutely.
What can be done to help these people the help they need? The caregivers who might relapse because they're treating a person who has also relapsed. I mean, you've got drugs in the house and real pain because the elderly have pain. So these prescription drugs, what's the programmatic approach that would help?
Well, I think, first of all, caregivers need to seek out local support. There's a National Family Caregiver Support Program. There are a lot of new initiatives underway, and I'm sure Marvel can speak to many of those that are available locally. So my recommendation is that a caregiver who is experiencing some of these issues contact, for example, their local area agency on aging, which is a nice touch point to find out what's available to support them in their community. And they most often get referred to other services locally to help them. And there may be many other problems in the home that they need assistance with. Maybe they don't have enough resources to pay for food. Maybe there's food insecurity. Maybe they're having trouble paying for their housing. So getting connected to local services is really, really vital. And from there, they can find out what's available in terms of mental health. And many communities do have older adult mental health programs that are part of maybe local government. Federally qualified mental health centers, for example, also have programs that they can reach out to. So definitely start with the area agency on aging locally.
Marvell Adams Jr., I'm going to bring you in at this point because this is an area of concern and expertise for you as well. But there's a among caregivers, there's a special category who we call the sandwich generation, who sometimes are caring for children and their parents, or older people in their family, or older people in their community, as well as watching out for young people. What can we do? What can be done to help these people with the services and support they need?
That's an excellent question, and you're absolutely right about the sandwich generation. The other name for is Generation X, for the most part, of which I am a part of. And it is a struggle because, one, you have the pressures of perhaps an older adult, a parent, or someone that you have in your life that needs supportive living, and you are serving that role, as well as having a responsibility for younger age children or adult children that you still have a responsibility for, that are in college or maybe right out of college. And so what that brings along with it is, one, managing perhaps medications for that older adult, managing your own medications, as well as perhaps having a role in your child's medications, and recognizing that when it comes to substance abuse disorder and opioid overdose and poisoning, there is comorbidity around depression, anxiety, and understanding that these all are things that not only the sandwich generation that's kind of in the middle of caring for, perhaps those part of the baby boomer generation and those that are part of millennial or Gen Z, and having a responsibility that also then is counterintuitive to their own mental health, and then exacerbating the problem, but then also recognizing that that services are not really built as well as they could be to support that type of multi-generational caregiving. So, you can think of caregiving youth, and there is some resources and recognition of the special category that caregivers that are under the age of 18 may play in supporting their parents. But now recognizing that, that sandwich generation that you talk about really is in a precarious situation because they're having to navigate their careers as the in many instances are peaking and they're in their most productive years, as it said. A Caregiver Action Network, we provide a no-cost help desk, which can be accessed through caregiveraction.org, either through web chat, through email, or through a phone call, as kind of a starting place or a one-stop shop for questions, seeking services. We can refer them through our team of social workers. And so really, when you come back to just that question of generational pressures that may make it even more complex, it's really about how can that individual, that sandwich generation person, reach out for services in a way that's going to be efficient, that's going to be effective for them, and also keep an eye upon the fact that they themselves need to have support for mental health care and self-care themselves, and with the unfortunate aspect of perhaps they themselves having a substance abuse disorder.
Yeah, no, I absolutely agree with Marvell. I think, over the past decade, we've seen a significant increase in the number of grandparents raising their grandchildren, specifically because of the opioid epidemic, where the adult children, sadly, have been victims of the opioid epidemic or are incarcerated. And it's incumbent upon the grandparents who may have been finishing their work life and planning for retirement now have to care for grandchildren. And as Marvell said, we've made some progress. There are kinship care programs that are being introduced all across the country, but we still have a long ways to go to provide the real support that these grandparents need as they're taking on some of these new challenges. Some of them embrace it completely, but still, need support to care for their grandchildren who are, could be in elementary school or pre-elementary.
So millions of Americans suffer from acute or chronic pain. They're not imagining that. And this is particularly, the elderly. It can be very debilitating pain. It can sort of erode the quality of life. Kathleen, how close are we to finding treatments for people that can deal with pain? Because that's not a trivial thing, but that doesn't get people addicted to it and kill them.
Pain management must be tailored to the individual. I mean, that's for those who work in the field, that's what they do. And they manage the pain not only with pharmacological treatments like the nonsteroidal anti-inflammatories and opioids, but non-pharmacologic treatments. We know that, for example, exercise is really effective in helping people with arthritis and their joint pain. We know that cognitive behavioral therapy is excellent for some people with certain types of pain. Sometimes acupuncture is effective, massage therapy, yoga. I mean, there's lots of things that are continuing to be studied around their effectiveness and who they're most effective for. So I'm hopeful that we will look not only at pharmacologic treatments, but non-pharmacologic too, and that everyone has access to those treatments that are most effective for their specific type of pain. I do worry many older adults do suffer. Many think that pain is a normal part of aging, that it's just part of the aging process and they don't get treated. Many are very stoic around their pain. And our message is there is help, seek help with your physician, and we can monitor if you do feel like you're becoming dependent on certain types of medications. There are things that can be done. At the National Council on Aging, we promote something called the Chronic Pain Self-Management Program. And it's a group-based program for people who do suffer from chronic pain, whether it's caused from arthritis or cancer or back injuries, for example, that looks at various aspects, both the physical, mental, and emotional aspects of pain, and helps them kind of put together a plan that they work on with their healthcare providers to better manage their pain.
Marvell, do you have anything to add to this area?
And I would say for the tens of millions of caregivers that are alongside individuals dealing with chronic illnesses, chronic pain, education and raising awareness is really critical when it comes to mitigating the effects of the opioid crisis. Because what you're having is kind of a system that when you have residential or facility based care, so a hospital, rehabilitation, a nursing home, tons and tons of parameters, guidelines, regulations around just the dispensing of one, pill, accountability around that, training for nurses, training for aides. But then you switch that to home care, and you have a caregiver picking up a medication from the pharmacist. They've got a busy day. Oh, do you want to speak to the pharmacist about that? No, that's okay. I'll go on about my way. And understanding that education around some of the non-pharmacological options that Kathleen just mentioned just now, education around some of the side effects that can take place that Dr. Copeland talked about around some types of medication for pain, whether opioid or non-opioid based pain medication, and understanding that caregivers really serve as a critical part of that care plan for an individual in managing their pain, and can help perhaps make a pathway to lessening the use of opioids, or at least helping mitigate the risk of abuse. But that comes along with having to have, adequate training and education in placing those resources readily available for those caregivers, so that they can be really well armed and equipped to help themselves as well as their loved ones navigate pain management.
There have been historic disparities in the African American community with drug abuse. The fentanyl thing seems to cut across all demographic groups. But are the inequities in services being addressed adequately in your view?
Are inequities in services being addressed adequately? No, I mean, there's always a disparity in access, right? So if it's related to healthcare, we know that there are significant disparities, whether that comes from a lack of resources due to location, a lack of resources health. So, there's insurance that people have it cover those type of services. So we know that the healthcare system as a whole is not equitable in its provision of services and care. And so that's not, the opioid crisis or epidemic is not excluded from that.
Marvell, you were nodding your head. So and this is an area that you have expertise in too. Would you like to weigh in?
No, I was appreciating what Dr. Copeland was stating, but being based in Baltimore, Maryland, where I live, even though our offices are in Washington, D.C., this really is an area that has been the most hard hit in the sense of impact from opioid overdose or poisoning. And so thus my nodding, but also it's also no coincidence that Baltimore is a predominantly Black city. And as Dr. Copeland pointed out, that disparately, the percentages of African American Black individuals across the country, would give one reason to think much lower instances of opioid poisoning or overdose, but that is quite the opposite. And the healthcare system has not adequately responded to that crisis in ways that perhaps other communities have seen.
We've got time for one more question. I'd like to ask all of you what we in the media can do. We're so busy, the latest twist and turn in the presidential race, and these get great clicks and all that. But how do we share stories about the challenges that families face in keeping themselves and their parents healthy from the scourge of opioids to other to these mental health to depression. What's a mechanism for sharing these stories and helping the educational component that you mentioned, Marvell? How can that be done?
Yeah, I mean, I'll just start off by saying that encouraging individuals to seek out and find community, that you are not alone, no matter how unique you may think your circumstances are. If you think you're a 40 or 50 something Gen Xer that has a parent living, in a in-law suite out back and a kid in college that comes home, every day, you are not in unique circumstances by any stretch of the imagination. And should you yourself be dealing with substance abuse disorder, a loved one or anyone, that you know of, reaching out for help and recognizing that awareness and media can really support reducing the stigma that's associated with that, and being able to recognize that individuals don't step forward for help, one, if they think the help isn't there, or if they think that they're going to be shamed or embarrassed for reaching out for that help. And so being able to have raising awareness about the fact that this really is not something to be hidden, because it is such a pervasive problem that it is almost impossible not to have someone in your circle or outer circles that's been impacted by a substance abuse disorder. And so recognizing that and really taking away that stigma from a societal aspect of it is one way I think that we can help caregivers and those that their care recipients really mitigate some of the risks associated with pain management and opioid abuse.
Dr. Copeland.
Yeah, I think humanizing the message around opioid use and substance use and caregiving. I think that a lot of times what we get is statistics. This is what's going up. This is what's going down. It's, 2 times worse than it was 10 years ago. Whereas if we really humanize the experience and not the outliers, not the stories that you kind of see that tend to make the media, but really the day-to-day caregivers that are dealing with this and really making people recognize and provide stories that they can see themselves in, and then resources for them to manage their circumstances. Like Mr. Adams said, I think that a lot of times you read these newspapers and people, even though they are in the midst of it, don't see themselves in statistics. And so I think humanizing and really making people realize how common this issue is and what that looks like on a daily basis to the average person will really help to expand people recognizing that they even need to get help, and then providing those resources for them.
If it's okay, I'm sorry, because it made me just realize that there also the piece of this that's imperative is that from a policy standpoint of ensuring that we readily support legislation and policy that makes it easier to be able to bring forward alternatives to opioids. Like Kathleen so well said earlier, that opioids have a place for pain management and other utilization, and so that's not a reason to say that we should be shying away from them. But what we should be really doing is really creating from a policy standpoint, an environment which alternatives can come to the market, that they can be utilized in a way that are safe and effective, and recognizing that we cannot build our system around just single sourcing of certain type of medication, but understanding that really there have to be alternatives out there that allow individuals that so choose to not utilize opioids or that want to lessen or move away from them, that they do have viable options out there for themselves.
Yeah, policy options are so important. And we have made some strides around integrated care, where we integrate behavioral health care, including substance use disorder treatments, into primary care, where people can get it in a more accessible way. But to answer your question, Carl, about what the media can do, I think the media can send messages of hope to older adults, to family members, to caregivers, to people in the midst of the opioid epidemic, that treatment and recovery do work, And help is out there. You have to ask for it. It's okay to ask for help. And it is out there. And we're seeing more and more providers as some of the policies are changing. Not enough still, but we are making some progress.
Well, that's a good note to end on. Optimism for what is a very difficult problem. These three people are doing the Lord's work, fighting on the front lines, trying to help America's families. And I want to thank each of them for sharing their thoughts with us. And thank you for watching today's program. For Real Clear Politics and Mothers Against Prescription Drug Abuse, I'm Carl Cannon.